Welcome back to Med-Surg Knowledge Nuggets, where we take big nursing topics and break them down into manageable, test-friendly content. Today we're talking about tuberculosis. So what is tuberculosis? Well, TB is caused by Mycobacterium tuberculosis. It is a lung infection. And Mycobacterium tuberculosis is a very tiny bacteria, very lightweight, and it floats in the air and it can stay suspended in the air for several hours, which is why we implement airborne precautions. Risk factors: low socioeconomic status, immunocompromised status, poorly ventilated, crowded environments, so where people are in close quarters like prisons, long-term care facilities, advanced age, so being over the age of 60, recent traveled to a country where TB is prevalent, immigration, especially from Mexico, Philippines, Vietnam, China, Japan, etc., substance abuse, and us healthcare workers. So let's take a look at this picture. On the left, you see a lung with latent infection. You see that little white spot there. So that means that this patient was exposed to TB and the immune system was able to kind of wall it off. So we do not consider this an active infection. The patient is not contagious. The next picture is cavitary tuberculosis. So here you see that it is an active infection. It is no longer being kept in check by the immune system. So what happened between latent and cavitary? So most likely what happened was the patient's immune system was compromised. So maybe the patient has uncontrolled diabetes, maybe they got sick with some other disease or condition, maybe they got pneumonia, they weren't doing well, and their immune system kind of dropped the ball and wasn't able to keep that TB walled off, so it became active. The third picture is miliary tuberculosis, and this is when TB essentially spreads out of the lung. It invades the bloodstream and it can spread to other organs, and it can even affect the brain. Signs and symptoms. So if you have latent tuberculosis, you're asymptomatic, you're not showing any signs and symptoms, and you are not contagious. If you become symptomatic, you are contagious and you have an active infection. There are some hallmark signs and symptoms like fatigue, weight loss, anorexia, which just means you're not hungry, night sweats, persistent productive cough for more than 3 weeks. So those are the signs that, say for example, a patient came into the doctor's office and said, hey, I had this cough for a long time, I've been losing weight and I'm sweating in the middle of the night. They are going to put a mask on that patient immediately and check for TB. So the sputum, that productive cough sputum is purulent. It can be, like white, yellow, green, thick, can be rust colored, meaning that there's blood in it, or it could even be blood streaked. Patient will have shortness of breath, orthopnea, and rales if you auscultate the lungs. So how is TB diagnosed? We can take a sputum culture and send it off to see if TB grows in there. We can do a PPD test, a purified protein derivative skin test, also known as a MAN2 test, chest x-ray, a NAT, which is a nucleic acid amplification testing, quantiferon TB gold blood test, and acid-fast bacilli smear and culture. So what we're going to talk about is that PPD test. So pictured here, you see an intradermal injection that will provoke an immune response if the patient has been exposed to TB. You inject this and you read it in about 48 to 72 hours, and that's to give the body's immune system to react if it's going to react. And what we're looking for in a positive result is induration. So induration is a palpable raised hardened area. So if you slide your finger across it, you'll be able to feel it. Now in the center picture here, you can see, because this is not a 3D picture, it looks red. We have erythema. Just redness is not considered positive. You have to be able to feel a hardened raised area. And oftentimes in practice, this happens where it is falsely said positive because the person who's reading it hasn't been educated on how to read it correctly. So if you do feel induration, you're going to measure it. And if it's 10 millimeters or greater in diameter, then we'll say that's positive. If the patient is already immunocompromised, and we're going to consider 5 millimeters as a positive test for them. So just to recap, if you have a positive MAN2 test, it doesn't mean that the patient has active infection. It just means that the patient was exposed to TB and now has an immune response to it. One thing to note is that if the patient has received the BCG vaccine, which is a vaccine for TB, we don't give that in this country, but other countries, some countries do administer it. If they've had that within the last 10 years, it can result in a false positive MAN2 test. So before the patient gets a PPD test, we ask them, and if they say yes, that they've had this BCG vaccine recently, then we are not going to give them the PPD test because we already know it's going to come out positive. So we will try a different form of testing. So this table details and gives examples of certain patients where we would consider 5 millimeter in duration a positive result versus 10 versus 15. So 10 is in the center, 15 is for everybody. So if you have a 15 millimeter duration, anybody with that would be considered positive. But these patients, for example, if you're HIV infected or if you're taking immunosuppressants like a transplant patient, then if you reach 5 millimeters, we're going to say that you are positive. So what do you do if you have tuberculosis? This is caused by a bacteria, so we treat bacteria with antibiotics. Now, what's something special about TB is that it is a long regimen of antibiotics, at least 9 months up to 12, sometimes longer. And this is daily medication of multiple different drugs. So examples of that would be isoniazid, rifampin, pyrazinamide, and ethambutol. These medications are potent and they're hard on the liver and can be hard on the kidneys. So we're going to monitor their renal and kidney function, and we're also going to educate them on kidney and liver health. So they shouldn't be, for example, drinking alcohol while taking these medications. Interventions. This is a respiratory condition, so we are going to provide humidified oxygen if needed, and we are going to keep an eye on that oxygen saturation. We're going to place the patient on airborne isolation. So lots of exams like to test you to see if you know what the priority is with a TB patient. If you come down to two answers and one is place them on airborne or give them, antibiotics, we are going to place them in isolation. We don't want them infecting other patients and we don't want them infecting us. So that is a safety, that is going to be our priority. Temperature, this is an infection, so we're going to monitor temperature. Now, we are going to send a sputum culture 3 times, okay, once a day on different days, send it off, and if all of those come back negative, then we can say the patient is no longer infectious with TB. We're going to monitor breath sounds, and we're going to give the antibiotics, and we're going to make sure the patient receives adequate nutrition. So in order to heal and recover, the body needs the nutrients to do so. So we need to make sure that they are eating enough because, as you remember, a sign of this would be weight loss and anorexia. So we're going to monitor nutrition status. Complications that can happen from TB: respiratory failure, bronchopleural fistula, pleural effusions, meningitis. So if that TB bacteria gets into the bloodstream, it can actually cross the blood-brain barrier, get into our brain, and cause neuro symptoms too. Lymphadenopathy, bone disease, liver and kidney failure. So we want to make sure we're monitoring those labs. They will need to get routine labs done. So teaching is very important because we need to let them know how important medication compliance is. So we all know about COVID. It was contagious and it turned into a pandemic. The same thing could happen with tuberculosis. So if the patient is at home and they have to take a medication every single day for up to a year, that's pretty hard. So there are initiatives out there where they actually send, the public health department will send a nurse to each patient's home that has TB and is on medications so that they could see with their eyes that the patient is taking these medications. It is that important. Support system. So if the patient, maybe they're forgetful, maybe they don't understand, we want to reach out to see who do they live with. Is there somebody who can help them because it is that important. All right, and we've reached our final nugget for tuberculosis. So as a recap, TB is contagious. It's airborne. It primarily affects the lungs. So we need them to be on airborne precautions. We play that vital role in making sure that they adhere to those prolonged antibiotics that they have to take for up to a year, medication compliance, and infection control. We're going to hopefully detect this early and collaborate with the public health department so that they can contact them, trace it, and help to reduce transmission in the community. There's going to be close monitoring for medication side effects, and we also want to provide nutritional support to make sure that they recover. Thanks for watching. If this helped clarify things for you, make sure to like, comment, and subscribe for more Med-Surg knowledge nuggets just like this one. See you in the next video.